We are at 9 a.m. So welcome new navigators and certified application counselors to the 2021 Wisconsin Health Insurance Enrollment Conference pre-licensing sessions. I'm Shannon Drake Burr with Covering Wisconsin. I am their workforce and affiliates liaison. And this morning I am filling in the host role for Adam, Van Spankeren, who is with us. But just stepping into this to ease up a few burdens. We're so glad you're here. And given that this is the first session of the pre-licensing conference, I have a few just sort of housekeeping things to go through. So just bear with me. And if you're having any technical issues or questions, maybe some of these things I'm about to share will help you out. So in regards to the conference links, please, for today, just leave this conference link open. It will be used for both of today's sessions. And then tomorrow, check your email first thing in the morning, and you will have tomorrow's link in your inbox. You can also go to Covering Wisconsin's homepage and to the conference page, navigate to the conference page specifically, and there will be links to each day's conference there as well. So you should get one both in your email, and you can also go to the homepage of the conference and find the day's links there. Please know that all attendees are on mute and will remain on mute throughout the session, and that is just to make it a pleasant experience for everyone and to eliminate background noise. If you have a question, please type it in the questions and answers box. We will take strategic breaks throughout the session for questions. We may do them all at the end. We'll just see how many we get and what they're about specifically, and we'll kind of figure it out on the fly. Please be certain to participate in the interactive questions during each session. It's okay if you're not confident in your answers. We are just looking for active participation from everyone. Also, if we get a lot of wrong answers, then we know we need to go back and explain that concept better. So it's actually very helpful to us. Pre-licensing certificates will be issued after the entire conference finishes. I know some of you are eagerly awaiting those. So you need to attend all 6 pre-licensing sessions that are happening this week. You need to attend all regular conference sessions. We're tracking attendance. We're sending that attendance to the Office of the Commissioner of Insurance, who will actually be issuing the certificates. And so then once you have your certificate, you'll be able to take the navigator exam, the navigator/CAC exam. It's called the navigator exam, but it is for both new navigators and certified application counselors. We want you to know that there will be 2 special opportunities after the conference ends that you might be interested in joining, and both are occurring on Friday, October 1st. So first off, we have office hours. Anyone can join those office hours and ask follow-up questions on any of the conference content, and that will be hosted by Adam Van Spankeren. And then later that morning, starting at 10:30, there will be a navigator exam study session. So for those of you who are preparing to take the Wisconsin licensing exam for certified application counselors and navigators, I imagine many of you are, can attend the study session and be better prepared for taking that exam. So that is all the housekeeping items I have for you all. I next want to step into the content of today. And our presenter, Rachel Withoff. So Rachel is a healthcare eligibility policy analyst at the Wisconsin Department of Health Services. Rachel primarily works on policy issues related to BadgerCare Plus and family planning only services. We are so pleased to have Rachel join us again at this year's conference. She presented last year as well. And we look forward to learning with Rachel about how to help consumers apply for Medicaid programs through income maintenance agencies. So without further ado, I give you Rachel Withoff. Rachel.
Great. Thank you, Shannon. Just making sure you guys can all hear me, right? All right, great. Great. So like Shannon said, this first session today, I'll just be giving you guys some information about applying for Wisconsin's healthcare programs. And I'll just jump right into it because I know there's quite a bit of information to cover today. Let's see here. All right, so just a quick overview of today's agenda. So I'll go through the purpose, program basics, how to apply for Wisconsin's healthcare programs, what to expect after applying, outcomes, and resources available for more information. So the purpose of this training is to provide navigators, CACs, partners, agents, and brokers with a basic understanding about how to apply for Wisconsin's healthcare coverage programs and what to expect throughout the application process. Just to let you guys know, session 2, which will be later this morning, will focus specifically on eligibility rules for BadgerCare Plus, and session 3 tomorrow with Nikki will focus on eligibility rules for Medicaid for elderly, blind, and disabled individuals. So just to give you a heads up, this presentation I'm doing right now, we might mention those things, but it will sort of gloss over them with the intention of going into more detail about the specific eligibility rules in later sessions. Another thing to just give you guys a heads up on, many of you may be aware that there's temporary rules or temporary changes in place due to, with the BadgerCare Plus policy and the EBD Medicaid policy. I apologize, I didn't include that in there in my slide, but also to the EBD Medicaid policy during the federal public health emergency for COVID-19. So these include, some maintenance of eligibility for existing members, postponement of renewals, suspension of premiums, suspension of the treatment needs question requirement for childless adults, and addition of the elderly, blind, and disabled adult population to presumptive eligibility, also known as express enrollment. Just to note, this is not presumptive disability. So I just want to say that, the information in the training today does not really include these temporary rules. And this presentation will be talking about how the rules normally are when we're not in this sort of COVID-19 public health emergency. So just to give you guys a heads up that some of the things I'm talking about today, if you're familiar with some folks that are, enrolled in the healthcare programs today, it might not seem like it is, but that's just because we're talking about normal rules here. All right, so jumping right into program basics. So BadgerCare Plus covers children ages 0 through 18, parents and caretaker relatives of children ages 0 through 18, pregnant women, and childless adults ages 19 through 64 who are not receiving Medicare. Again, like I said earlier, more details on BadgerCare Plus will be in the next session this morning. Medicaid for elderly, blind, and disabled, or EBD Medicaid, covers adults ages 65 and older, individuals who are blind, and individuals who are disabled. Again, more details on EBD Medicaid will be covered in Tuesday's session with Nikki. All right, so income maintenance. So most of Wisconsin's healthcare programs are administered by a network of county and tribal income maintenance, or IM agencies. IM agencies process applications, they make eligibility decisions, and issue benefits. All IM agencies use the CARES eligibility system to administer benefits. So in case you've heard of CARES, CARES Worker Web, CWW, that's the eligibility system that we're referring to. All program rules are the same statewide. So regardless of where you're living in Wisconsin, the same state rules apply to you. And applications are assigned based on where the applicant lives. So we'll get into this a little bit more when we talk about the access applications and things like that. But that's how applications are sort of sent to the which of the income maintenance agencies it's sent to for processing. It's based on where the applicant lives. All right, most county IM agencies are organized into 10 regional consortia. I do have a link there. And you can also look on the dhs.wisconsin.gov website that shows a map with sort of the regions and which counties are in which regions for the IM consortium. Milwaukee County IM is administered by the Wisconsin Department of Health Services, DHS, through the Milwaukee Enrollment Services, or MILES. The other exception is Menominee County IM is administered by the Menominee Indian Tribe of Wisconsin. And I should say that there are other tribal income maintenance agencies as well. Eligibility determinations. So when someone applies for healthcare coverage, the IM agency considers whether the person meets all of the non-financial rules for healthcare programs. For example, is the person a US citizen or does the person have a qualifying immigration status? IM agencies also consider whether the person meets all of the financial rules for healthcare programs. For example, does a 67-year-old applicant have assets below the EBD Medicaid asset limit? So those are really the two areas we look at, non-financial and financial rules. Based on the individual situation, which specific healthcare category is the most appropriate? That's another question we ask. So for example, does a person qualify for BadgerCare Plus or for a type of EBD Medicaid? So when someone applies for full benefit health coverage in Wisconsin, they do not have to specify which program they are applying for. So when people, you may have noticed if you've assisted people with applying before, on the applications, especially on the access application, we really just ask, are you applying for health care? And then it's up to the income maintenance agency to determine which healthcare program the person fits into. So it's not really up to the person to determine if they're a BadgerCare Plus, potential BadgerCare Plus member, or potential EBD Medicaid member. If someone is not eligible for BadgerCare Plus or EBD Medicaid, but might be able to enroll in a qualified health plan or QHP at the marketplace, their application will be transferred automatically to the marketplace. So in those situations, it's really a no wrong door approach. If they're, like I said, if they're not eligible for BadgerCare Plus or EBD Medicaid, we'll send that application over to the marketplace so they don't necessarily have to apply separately at the marketplace again. The idea behind this is to make it easier for the person to try to get into whatever health coverage is most appropriate for them. All right, applying for Wisconsin's healthcare programs. And I just want to take a quick break here. Shannon, is there any questions that are coming through or anything that I should address right now?
We don't have any questions right now, so we're okay. Thank you, though.
Okay, great. So I'll just keep moving forward then. All right, so filing an application. So I talked about this, mentioned this a little bit before, but a person may use any of the following methods to complete and submit an application. So there's online at access.wisconsin.gov, in-person or face-to-face applications with a worker, by phone, calling the income maintenance agency, or by paper application. And then another thing just to note, in addition to healthcare, BadgerCare Plus and Medicaid, people can also apply for other programs in Access, including food share, family planning only services, Wisconsin Shares Child Care Subsidy, Wisconsin Works, also known as W-2, job access loans, and emergency assistance. So people can apply for multiple programs with just one application. People can also start a request for assistance for the WIC program, or Women, Infants, and Children program. Of course, if somebody just wants to apply for healthcare, they can also do that as well. All right, filing date. So filing date is the day a signed healthcare application is submitted to the IM agency. In most cases, eligibility starts as of the first day of the month in which the application was filed. So if an application is filed today, September 13th, eligibility would, in most cases, would start September 1st. Applicants can also request up to 3 months of backdating for most programs. So, so if somebody requested backdating for their application they submitted today, September 13th, and they asked for all 3 months, that would go back to June. Sorry, I had to think about that for a sec. So it'd be June, July, and August would be the 3 backdate months. And then of course, September is the month of application. So somebody could get eligibility all the way back through June 1st. Just to note, some pregnant women who are immigrants or inmates, as well as children with higher incomes, do not qualify for the backdated coverage. So it's not exactly every population, but many populations. IM agencies have 30 days from when they receive the application to determine eligibility. Right, so everyone applying for or receiving BadgerCare Plus or Medicaid has the right to be treated with respect by IM agency staff, have their civil rights upheld, have their private information kept private, get an application or have the application mailed on the same day it is asked for, file an application right away, even if they are not in the correct office, and get a decision about their application within 30 days of the day the agency receives it. Responsibilities. So everyone applying for receiving BadgerCare Plus or Medicaid is responsible for providing accurate information, providing proof of information when requested, reporting changes as required by the agency. And then there's also some more information on rights and responsibilities. The whole thing is listed in the Enrollment and Benefits Handbook. And so there's the link there on the slide, but it is publication 0079 if anybody's just searching for it on the DHS website in the Forms Library. All right, and I think we're ready for poll question number 1.
And Rachel, that is live right now, so we'll give attendees just a minute to answer that.
Great, sounds good. Thank you, Mike.
All right, and I think we are done with the polls. So Rachel, I don't know if how you want to handle that, but it looks like majority was for option number 4.
Yes, and that is correct. Yes, so all the other ways are allowable ways to submit an application, but not completing an application through an online chat. That's not a functionality we have today, and that's not something that people can do to validly submit an application. But the other ways are all valid ways to submit an application. So great job, everybody. All right, moving on. So methods of applying. So again, we have access. Going into this a little bit deeper. So access connects you with the help you need when you need it. That's kind of our little tagline on the website, and that is really the purpose of access there. So as you can see, there's the screenshot here, where somebody can go in, click apply now. You can also log in, and then there's further options too down the page. So again, access functions, see if you can get help, a short screening tool to find out which benefits you might be able to get into. There's no login needed for this. It's a very simple, streamlined, just really a handful of pages so that people can get an idea of if it's, what programs they might qualify for and sort of what they may be interested in applying for. This used to be known as Am I Eligible? So you might remember it as sort of an AIE or Am I Eligible title, but it has gotten an overhaul recently, and so it's sort of new and improved. Another function is apply for benefits. We apply online for healthcare, food share, childcare, or W-2. Again, that's the programs I listed earlier in the presentation. That's the true application there. And another thing to note, in some places, applicants may be able to get an immediate eligibility decision for healthcare. You may have heard this referred to as real-time eligibility. So there's some applicants that we are able to basically get all the information we need right away to be able to make that eligibility decision, and so they will receive that decision right away. Other access functions, so we have the access account. You can check your benefits, renew benefits, report changes, view notices, perform other benefit management functions. For these functions, though, people will need to create and authenticate and use their access account. So this is something that people do need to create that access account for. Another thing to note, members can also check their benefits and do some benefit management functions on their My Access mobile app, and more information on that later in this presentation. So all access pages are available in Spanish by clicking the Espanol link in the corner. Users will be able to view help text for questions that may need additional explanation. We know that some of the questions are a little bit tricky or maybe confusing, and so there is sort of help text available for those questions on the screen if people need some more information to be able to answer those questions. Just another thing to note, so there is an access training site. So here's the login, here's the screen. I think I might, I can make sure that login not login information, but the link for this training site maybe is included in the resources. But this is where people can go to do some practice applications. Again, these are do not submit real applications through here. and do not submit any training applications through the real site, but this is an area where people can go to practice those applications. Another option, walk-in and telephone. So individuals have the option to apply in person at their county or tribal IM agency. They may also apply by phone. Each consortium has a central phone number for taking applications and other customer services. Again, we have the phone numbers and office locations available at the DHS website on the IM agency page. So that information there for the phone and the address for all the IM agencies. Mail-in or paper applications. So individuals can also apply by mail. I know I said earlier that individuals don't have to necessarily know whether they're possibly eligible for BadgerCare Plus or EBD Medicaid, and that in the access application, they're really just applying for healthcare. However, we actually do have different paper application forms. There's one for BadgerCare Plus and one for EBD Medicaid because they are different eligibility rules. However, again, either application can be used to make a request for full benefit health coverage. So if the person guesses wrong, it will still count as a valid application for healthcare. And likely what would happen is the income maintenance worker would just follow up with the person to gather the necessary information for the program that they actually are looking to qualify for. All right, looks like we're ready for poll question number 2.
All right, we are at a minute. It looks like majority of everyone answered number 1.
All right, great, everybody. Yes, you cannot request a fair hearing to appeal a denial of benefits in access. There's a separate process for doing that where the person submits the request to appeal to the Division of Hearings and Appeals. So there's more information about that process in the Enrollment and Benefits Handbook that I mentioned earlier, and also on any notice of decision that the person receives, which again we'll go over a little bit more, but any decision, notice of decision the person receives will also have information about how to request a fair hearing. All right, great, everybody. And Shannon, thank you for posting. I did see that you had posted the link to the Access training site, so thank you for doing that. All right, what to expect after filing an application. So verification. So before making a decision about eligibility, IM agencies must verify the information the applicant has reported. In many cases, IM agencies can use data exchanges to verify the following information: citizenship, immigration status, earnings from a job, Wisconsin unemployment benefits, Social Security, supplemental security income, and child support payments. In other cases, applicants will be asked to submit proof of what they have reported. So proof can be submitted by fax, mail, in person, through Access or MyAccess. We encourage people to use Access and MyAccess if they can to submit that verification because it submits a document to IM right away, so you're not waiting for mail or anything like that process. And also MyAccess allows people to use their cell phone to take a picture of a paper document and submit it. So no scanners needed. So that is an easier way, I think, for most people to be able to submit a document that they have that's in paper. Verification checklist. So the agency will send a verification checklist, or VCL, called a notice of proof needed. That's sort of the title that'll be on that when it comes to the person. And it will list the items that are needed. So people don't necessarily have to guess on what an agency might need or anything like that. That VCL will list it all out. So VCL will also be sent if the agency is missing information needed to make a decision. Like I said, for example, in that earlier slide I mentioned earlier with the paper applications, if somebody, submitted a BadgerCare Plus paper application, really it looks like they might be eligible for EBD Medicaid, the VCL might include, the information that the income maintenance agency would need to determine the person's eligibility for EBD Medicaid. An important thing to note, if an applicant does not provide the requested verification, the application will be denied. So it's really important for people to provide that requested verification. And if they have any sort of questions or any sort of difficulty getting that verification, they should contact their income maintenance agency right away to let them know. So the verification checklist, things on it. So it includes the verification requirements for BadgerCare Plus or Medicaid, as well as food share, if the person is also applying or open for food share. It provides the due dates for providing the information requested. It contains specific examples of documents that are needed. So it'll tell you, so for example, if you are needing to provide some sort of proof of your income, it will give you examples of things like pay stubs and other things that might be used, that you could use and submit to provide that information. It also includes a document tracking sheet, which can be used to submit documents that you're submitting, in paper format. So you're mailing in, you're faxing in, you're submitting in person. We do highly recommend that you use the document tracking sheet when submitting verifications like that, because it just makes sure that the documents are applied to your correct case, and it reduces the risk of documents sort of floating around and taking time to be connected with your application or your case. So here's an example of, again, notice of proof needed is sort of the header of that letter that gets sent. It tells people that this is for BadgerCare Plus benefits. They need to provide this information. Again, document tracking sheet will be at the end of the notice that the person can sort of attach to their documents they're submitting. It will explain what program that the proof is needed for. It'll give a due date. And it'll give the contact information of how to send that verification or how to contact the income maintenance agency if there's any questions or anything like that. Again, and more information on that VCL, there's sort of a proof needed section. Again, it will say exactly the information that's needed, even calling out specific, in this example, employers. It'll say who, so who on the case that this information is needed for. Again, like I mentioned, some examples of the types of documents that could provide that information. Again, the program and then the due date again. All right, so getting into possible outcomes. So after the IM agency has verified the information reported on the application, the agency will make a decision about eligibility. The applicant will receive a letter telling them if the benefits are approved or denied. This is called a notice of decision, which I mentioned a little bit earlier. So the notice of decision includes the following information. You have the summary, which lists the benefits that have been approved and denied, as well as contact information for the IM agency. You have benefit details, such as who is enrolled, dates they're enrolled, who's not enrolled, and if they're not enrolled, the reason why. It includes household income and deductions. So these sections list the income and deductions on file for the household. Members should read through these to check to make sure that this information is correct. Because mistakes could be made, and so they need to. We always advise, please review your information on the notice, and if you see something that's not correct or something that's confusing, please contact your income maintenance agency as soon as possible. And then an information on how we counted the income. So the section lists the amounts and limits that were used to decide whether the member is eligible. And again, we'll get into this more when in the other sessions where we talk about specific programs and their rules, but depending on the program, not all types of income are counted, or there may be, some sort of like disregards and things like that. So this will show more information about that. Also, reporting rules. So like I mentioned earlier in the rights and responsibilities section, members are required to report certain household changes and things like that. So if benefits have been approved, this section tells members what changes need to be reported to their local IM agency and when. So very important, members must contact their IM agency or report changes in access. Changes reported to member services, so that's the phone number on the forward health card or the person's HMO, are not shared with the income maintenance agency. So that's something I think people have been confused about in the past. They've reported some sort of change to these other member services or the HMO or their doctor's office or something and thought that maybe that information would somehow make its way to the income maintenance agency. It does not. So members, they must make sure to contact their income maintenance agency or report changes in access, for any of those reporting rule requirements. Otherwise, you could run into issues where the member may have to pay back benefits or something like that. All right, another section, key contacts. So this section provides information about who members should contact with questions. And then again, fair hearings, like I mentioned earlier, the last page of the notice provides information about fair hearings, including the date by which a hearing must be requested and how to ask for a fair hearing. So getting more into fair hearings, if benefits are denied, reduced, or ended, and the applicant or member believes the IM agency made a mistake, they can contact the IM agency, they can ask the agency for help in requesting a fair hearing. They can also directly contact the Division of Hearings and Appeals to request a fair hearing. Again, all that information will be on that notice of decision or in the Enrollment and Benefits Handbook if you want to take a look there. So at the hearing, the hearing officer will hear from the applicant or member and the agency to find out if the decision was right or wrong and require the agency to take action as appropriate. After the hearing officer will send a written decision to both the individual and the agency that sort of explains their decision and what they're ordering or not. All right, looks like we're ready for poll question number 3.
And that is time, and it looks like everyone overwhelmingly voted for option number 5.
Great, yes, that's correct. Option number 5. So permanent forward health cards for members are not included with the notice of decision. And by permanent forward health cards, I should clarify that I meant like the plastic cards that you would keep in your wallet or purse or something like that. So those are sent separately to people. I should note that if somebody had a forward health card previously because they had been eligible for health care for BadgerCare Plus or EBD Medicaid before, they can still use the forward health card that they had received back then. They will not necessarily receive a new one when they are newly enrolled in healthcare benefits again. But if they do need a new one, there is information that they can contact to request a new card. One thing I should note here is that I mentioned at the very beginning, I think, of this presentation that some people can become eligible, get their real-time eligibility decision where they find out they're eligible right away. In that case, there will be sort of like a paper forward health card that's temporary, and it is on the notice of decision. But again, that's a paper card, and it's only used while the person's like waiting for their permanent plastic forward health card to come in the mail. All right, so getting into receiving services. So again, more on the forward health card. So each eligible person will receive a forward health card, which should be shared with providers when services are requested. Again, if somebody has received a forward health card in the past, they will not get a new one unless they request it by calling member services. And member services number is 1-800-362-3002. And that's an example of sort of what the forward health card looks like. All right, covered services. So covered services, the full list of covered services, it's listed in the Enrollment and Benefits Handbook that I mentioned earlier. One thing to note, some services may require prior authorization. So the provider will request authorization on the member's behalf. For some services, members may be required to pay a copayment or copay. Most copays range from 50 cents to $3. Providers may make a reasonable effort to collect the copay, but they may not refuse services if the member does not pay. Again, for questions about covered services and for help finding a BadgerCare Plus or Medicaid provider, contact member services again at 1-800-362-3002. All right, so diving into renewals. So again, I should say again, this is, we're talking about regular rules here, so not the rules during the public health emergency for COVID-19. So just to know, because this is something that is rather different. So members must renew their eligibility every year under regular rules. So the renewal process can be completed online and through Access, by phone, in person, or by mail. Members will receive a letter with instructions for completing the renewal 45 days prior to the end of their 12-month certification period. In some cases, eligibility can be renewed through an administrative renewal. So that occurs when the IM agency is able to verify all information through data exchanges, like we mentioned at the beginning of the presentation about the different information that can be received through data exchanges. And in that case, if an administrative renewal does happen, the members must receive a summary of information that was used to renew the benefits, members should review that summary and report any changes, or if anything is not correct on that summary, they need to report that to the agency within 30 days. All right, poll question number 4.
So I will read it. This is question 4. Under regular rules, which of the following is false? Note, regular rules mean when the COVID-19 public health emergency temporary rules are not in effect. So option 1 is members will receive a letter with instructions for completing their renewal. Option 2 is members always need to submit a renewal form to their income maintenance agency as part of the renewal process. Option 3 is the renewal process can be completed by phone, mail, in person, or online. And option number 4 is members must renew their eligibility every year. So again, we are looking for which one of the following is false. So which one is incorrect? Oh, I clicked the wrong button, Mike. I apologize. I'm going to relaunch that. Can everyone answer that one more time? I got click happy, my fault. Okay, so we're well over a minute because I shut it down early to start. There we go. So most people answered correctly. Go ahead, Rachel.
Thanks, Shannon. Yes, most people answered correctly. The false answer is members always need to submit a renewal form to their income maintenance agency. As we mentioned in the earlier slide, there could be, there are folks that get administrative renewals. And so they don't need to actively fill out a renewal form in those instances. So great. And Shannon, thank you again for posting those links on in the chat to the BadgerCare Plus handbook and the COVID information and the covered services information. So thank you. All right, so we're getting close to the end here. So additional resources. My Access mobile app, so just some information about this. So members with authenticated My Access accounts can download the My Access mobile app to do the following. You can check your benefits, see the programs members enrolled in and when the next renewal is due. They can get reminders. You'll be reminded of actions the member needs to take or documents the member needs to submit. Like I said earlier, they can submit documents. They can take the photo of a paper document, submit proof at any time. And then they can also check the status of the document in real time as far as where the agency is with processing it. This can be downloaded, this app can be downloaded for free at the App Store or Google Play. I should note that DHS is in the process of a multi-phase project to modernize Access. As I mentioned earlier, there was modernization being done, or that had been done to the Am I Eligible process, a little screening tool to see what you could possibly be eligible for. So one of the parts of that project is to add more features and further enhance the My Access mobile app. So we're hoping to roll those out over the next little bit in the future to add even more functionality for members with that mobile application there. All right. So other resources for members, the guide to applying, that includes information about who can enroll, how to apply, required verification, benefits and services available, rights and program rules, and fair hearings. So it's a lot of the information I talked about today, but it's in that nice sort of paper booklet that can be easy to flip through and reference. Again, I mentioned it several times on this presentation, but the Enrollment and Benefits Handbook is sent to all applicants and members. So it includes information about the benefits and services available, program rules, required verification, change reporting requirements, covered services and prior authorizations, rights and program rules, fair hearings. Again, that's the link. It's publication 00079. If anybody wants to look it up, but again, it is automatically sent to applicants and members, periodically as people are open. So, so everybody should get that document eventually, and then as it is updated over time, people will continue to get updated ones as well. One thing, actually, I'm going to backtrack a little bit. One thing I forgot to mention when talking about the covered services. I know one thing that's, I guess is not new, but maybe it was introduced not too long ago, but members may not pay more than 5% of their household income for monthly premiums and copays for BadgerCare Plus or Medicaid card services. So that limit does not apply to deductibles, patient liability for institutional Medicaid, or cost sharing for home and community-based waiver services. That 5% cost share limit does apply to members eligible for BadgerCare Plus, SSI Medicaid, and most EBD Medicaid programs. Members enrolled in MAP and senior care do not have cost sharing limit. So that was just something I wanted to note, that there are some programs that do have that limit for premiums and copays that they're paying for. More information for contact information. So income maintenance agencies, again, they do the eligibility determinations for BadgerCare Plus and Medicaid. That's where you need to report changes. They can answer questions about the programs and things like that. Another area is aging and disability resource centers. So they do enrollment counseling for home and community-based waiver programs, and provide a lot of other good information on aging and disability related programs. Member services, again, general member questions, information about covered services, help with finding a local income maintenance agency. Their phone number is 1-800-362-3002. That's also where you can request a new Forward Health Card if you need a replacement Forward Health Card. Again, Division of Hearings and Appeals, that's where you can request a fair hearing. Their number is 608-266-7709. We also have the link to their website that you can go to learn more information about how to request that fair hearing and what the fair hearing process is like. Resources for partners. So we have information about Wisconsin's healthcare programs, including member fact sheets and other useful publications that can be found at the DHS website, dhs.wisconsin.gov/forwardhealth/index.htm. We also have information for partners in Southeast Wisconsin if you happen to be located there. It's dhs.wisconsin.gov/publications/P01725.pdf. So again, that's publication 01725, and that's information for partners in Southeast Wisconsin. And then just in general, if you guys have questions related to BadgerCare Plus or Medicaid, please feel free to direct those questions to DHS Forward Health Partners at wisconsin.gov. Again, that's DHS Forward Health Partners at wisconsin.gov. There's a staff here that manage that inbox, and we'll be able to direct your questions to the right place to get the answer. All right, I think that's actually all I have for the presentation today. So Shannon, are there any questions that have come in?
We do have a few questions. Ooh, got some feedback there. So thank you so much, Rachel. First, thank you for your great presentation. And we can dive right into questions. So our first question is about, I believe, tuberculosis-related Medicaid, and how that interplays with BadgerCare and other Medicaid programs. So the question is, applicants who have TB are not eligible to apply anymore, regardless of statutes. It's a little vague, so I have asked for clarification, and if that comes in, I'll share it with you. But Rachel, anything you can share with us on that?
I should say that tuberculosis only services Medicaid is a program, sort of a separate program from BadgerCare Plus. But if somebody does qualify for, does meet the BadgerCare Plus requirements, even if they have tuberculosis, they could still qualify for BadgerCare Plus, if they're meeting the financial and non-financial requirements for BadgerCare Plus. If they don't meet those requirements, then they could possibly be eligible for the TB only Medicaid. I have to say, I don't have a ton of experience directly working with TB Medicaid, so I can't, I don't know a lot off the top of my head about that. But but as far as I'm aware, that is still a program that people can apply for. So I agree. If you get more clarification on that person's question and what they're asking about, that would be helpful. But as far as I know.
This is Maciel. Good morning, everybody. I have had experience with partners applying for TB Medicaid for those who are undocumented. And the policy has changed from going ahead and doing those applications through BadgerCare Plus and now has to go through EBD Medicaid. So that's the only change that has taken place. There may be some confusion as to how to submit those applications or who's processing those, but if you have specific questions or a specific case issue, please email that inbox that's listed here on the slide, and we'll be happy to go ahead and look into that for you.
Great,
Thanks,
thank you.
Marcia.
Yeah, thank you for jumping in there. I think that's really helpful. And I think that the asker, that was their clarifying question about people, you know, and their legal status. So I think we got the answer. Great. So next we're going to do, we have another question, and it's, if a patient is blind, but not a citizen or a resident, can they receive EBD benefits?
Nikki, you're our EBD person. Would you be available to take this question?
Yep, you bet. So there is still that non-financial rule that individuals would have to be a citizen or qualifying immigrant in order to be eligible for EBD Medicaid. So they would have to have either citizen, they would have to either be a citizen or have a qualifying immigration status. You bet.
Great, thank you. And as long as we, both Nikki and Maciel, feel free to jump in here because we have another follow-up on the TB Medicaid. The question is, does TB Medicaid still not pay for room and board?
Sorry, I don't have a lot of experience with TB Medicaid. Maciel, do you have?
Mike, are we confusing TB tuberculosis Medicaid with some of the behavioral health rehab services? I honestly think we're confusing those
Okay,
benefits.
all right,
So
that's fine.
We'll just share clarification.
We'll just move along and look for clarification if there is any to be had. Okay. So our next question is, do children of undocumented immigrants qualify for Medicaid?
Yes, and Nikki and Maciel, please weigh in. But yes, if the child themselves meets the eligibility requirements, the non-financial financial eligibility requirements, they can qualify for BadgerCare Plus or Medicaid themselves, regardless of their parents' immigration status. Nikki or Maciel, did you guys have anything more to add to that?
Just to go ahead and clarify is that if the child is a United States citizen, they definitely qualify for BadgerCare Plus, if they meet the requirements, of course. But the status of the parent is not looked at when it comes to the application of the child. Now, if the child is an undocumented individual and they have an emergency services where it's urgent and it's life-threatening and they do the application to meet the income requirements, then yes, they can go ahead and get qualification during that emergency period.
And I just also want to share that at 10:15, so coming right up, Rachel is going to stay with us, and we're going to, the next presentation is on eligibility for BadgerCare Plus. So we're going to get into the meat of some of that and provide a lot of clarification around the eligibility rules, whereas this morning's presentation was focused on how do you apply for benefits. Next up will be what are the parameters of eligibility. So I'm just going through questions. Okay, I think we've got some questions about where the PowerPoint will be posted, and that'll be posted on Covering Wisconsin's website. So I'll just, if you go to coveringwisconsin.org and then navigate to the conference tab, when those presentations go up, that's where they will be. And let's see. Done with that. Just going through any more. There's a question about the polling questions and just giving a little bit more time for answering. And yes, in the next session, we'll extend a little more time. I will also read each question aloud and all the answers, just to make it easier and more accessible for everybody who is on this presentation. So thank you for making that request. We are happy to accommodate it. And I think the rest of these, I'll do a final call here for additional questions that I am not seeing anymore. Any last questions before we take a break, and then come back at 10:15 for a presentation on eligibility for BadgerCare Plus? Okay, I'm not seeing any additional questions. So thank you so much, Rachel. Thank you also, Nikki, and thank you, Maciel, for jumping in. Everyone, you can leave your session open, and everyone but the panelists are on mute. So panelists, you can go ahead and mute yourselves and stop video, but leave the session open. We will take a break and we will reconvene at 10:15. So you know, get some coffee, get some water, do some jumping jacks, and come back here in 14 minutes. Thanks all. Okay, go ahead, Rachel.
Great. And Shannon, just to know, I know we're getting short on time. I know this has been a really good conversation, and I'm glad that we're really taking the time to get through and really, you know, make sure that there's an understanding of sort of how this works. But I know just time-wise, I know I'm probably running a little bit behind, so I didn't know how much leeway I have to maybe go over 11:15.
That's a great question. So let's just keep going, Rachel. We'll pause on any additional questions. We'll hold, and you just keep going with your presentation. And people who can stay on with us can stay on. We can leave this open as long as you have the ability to stay a little bit later.
Yep. Okay. Sounds good. All right, so getting into how income is counted and whose income is counted. So in general, all household members' income is counted. However, if a household member is a child or tax dependent of another household member, his or her income is only counted if he or she is expected to be required to file a tax return for the current year. So this includes children or tax dependents who expect to have more than $12,550 in earned income, or more than $1,100 in other income for the tax year. For this rule, other income does not include child support, Social Security, supplemental security income, also known as SSI, workers' compensation, veterans benefits, money from another person, or educational aid. These thresholds are updated annually. So really, this is a lot of times this is children who have teenagers who have a summer job or something like that. This is sort of the people we're talking about here, unless they are making more than $12,550 in earned income for the year, or of course those children that have the other types of income over $1,100, we would not count their income unless they go over those thresholds. So revisiting example 6. So Jocelyn is divorced, lives with her 17-year-old daughter, Macy. Jocelyn plans to file taxes, but Macy's father, Chris, plans to claim Macy as a tax dependent this year. So that was what we covered earlier. So as a recap, using tax rules, Jocelyn's household size is 1 because she is a tax filer with no tax dependents. And then Macy's household size is 2, her and her mother, because it's Chris, the parent who lives outside the household, who's claiming Macy. So she ends up falling under relationship rules. So let's say Macy has a part-time job at McDonald's and is earning approximately $400 a month. When looking at Jocelyn's eligibility for BadgerCare Plus, so the mom's eligibility for BadgerCare Plus, she's the only household member in her household size, so only her income is counted, and that's what her BadgerCare Plus eligibility is based off of. For Macy's eligibility, she is the child of another household member, Jocelyn, so her income is only to be counted if she's expected to be required to file. So since she expects to earn $4,800 this year from her job, she's below the expected to be required to file threshold, so we don't count her income. So only Jocelyn's income will be counted for Macy's eligibility, because again, remember that Macy has a household size of 2, herself and Jocelyn. So if Macy were to earn $1,200 a month or actually this, I think I may have made a mistake here. I apologize. Nope, I did right. Sorry. So if Macy were to earn $1,200 a month or $14,400 a year, she would be above the threshold, and this income would be counted in addition to Jocelyn's for Macy's eligibility. So Macy's, in that situation, it would count her eligibility and her mother's eligibility, or sorry, her income and her mother's income. So what income is counted? So most taxable income is counted for BadgerCare Plus. This includes, but is not limited to, taxable gross earnings from a job, taxable earnings from self-employment, unemployment compensation, financial aid if used for living expenses, taxable retirement pension and annuities, and interest and dividends. Note that Social Security income is usually not taxable, but it is counted for BadgerCare Plus. Examples of common types of income that are not counted for BadgerCare Plus include child support, SSI, gifts or other money from another person, workers' compensation, and veterans benefits. Deductions. So pre-tax paycheck deductions are allowed as BadgerCare Plus income deductions, so they wouldn't be counted for income. For example, pre-tax contributions to health savings accounts. So tax deductions listed on the IRS Schedule 1 in the Form 1040 are also allowed. Examples of those include student loan interest paid, higher education expenses, self-employment tax, and there's several others in there as well. Itemized deductions like mortgage interest and charitable contributions aren't allowed as deductions for BadgerCare Plus income. All right, so poll question number 4.
Okay, question number 4. What type of income is not counted for BadgerCare Plus? Answer 1, Social Security payments. Answer 2, child support payments. Answer 3, taxable earnings from self-employment. Answer 4, unemployment compensation. Answer 5, taxable gross earnings from a job. So again, what type of income is not counted for BadgerCare Plus? First answer, Social Security payments. Second, child support payments. Third, taxable earnings from self-employment. Fourth, unemployment compensation. Fifth, taxable gross earnings from a job. Okay, so Rachel, what type of income is not counted for BadgerCare Plus?
So most of the respondents are correct. Child support payments are not counted for BadgerCare Plus. All right. So getting into special situations, this is just a list. I will run through each of those. I have more information. So presumptive eligibility, PE, also known as express enrollment EE or temporary enrollment TE, it provides up to 60 days of benefits before applying for ongoing benefits through the Income Maintenance Agency. So this is available to children, pregnant women, and adults under age 65. How this happens is usually people go to, I mean, there's some partner organizations, but I think in most cases it's people going to their doctor's office or clinic or a hospital. And at that point, the realization is, the provider there realizes that they don't have health coverage, or they appear like they would be eligible for BadgerCare Plus. And so the provider can do this presumptive eligibility determination with that person to get them that temporary eligibility, where the intention is to sort of provide that short period of time of benefits while their application is, they have to apply for the they should apply for the full benefits, and then it's sort of giving that additional time for them to do that. A note, PE has been temporarily extended to elderly, blind, and disabled adults during the COVID-19 public health emergency. Again, like I said, facilitated through partners, providers, and or qualified hospitals. And there is a streamlined online application for BadgerCare Plus or family planning only services that the providers and hospitals and partners do with the person that basically just sort of gets basic income about their non-financial and financial eligibility. Gap filling. So in most cases, as I mentioned earlier in the presentation, eligibility for BadgerCare Plus is based on monthly income. At the marketplace, eligibility for APTCs is based on expected annual income Only people with household income above 100% of the FPL are eligible for APTCs. Someone can be ineligible for BadgerCare Plus because of high monthly income and ineligible for APTCs because of low annual income. So for example, James is unemployed for most of 2021, but starts a job in October earning $3,000 a month. So as a single adult, he is well above the monthly income limit of $1,073 for BadgerCare Plus, but his annual income is only $9,000, which is below the 100% FPL and makes him ineligible for APTCs. So in situations like this, individuals can enroll in BadgerCare Plus through the end of the calendar year based on their annual income. Again, this type of enrollment is called gap filling, and that's the one scenario I mentioned earlier in this presentation where we look at the annual income for BadgerCare Plus eligibility. So gap filling enrollment can happen when the marketplace sends an application to Wisconsin that's been identified as a possible gap filling situation. The applicant has a letter from the marketplace stating that they may be eligible under gap filling rules. An IM agency identifies that an applicant or member appears to be eligible under gap filling rules, and an applicant or member requests a determination based on gap filling rules. So again, this gets into trying to make it, trying to reduce some burdens or barriers for people to be able to find, where they can get their coverage or what the appropriate place is for them, to try to, so that hopefully they aren't just being like kicked back and forth and not able to get coverage.
So I just want to quickly clarify that you, as an assister, if you're doing a three-way call with an income maintenance agency and you think that Medicaid is likely the most appropriate coverage for someone, but they fall out of those monthly income, parameters, but their annual income is below the threshold, that you just say those words. You say, we'd like to do a gap filling application. And the person at the other end at the IM agency should say, okay, let's look at this. Let's look at annual income instead of monthly income.
Yep, great. Thank you for clarifying that, Shannon. Yep. I should note that even if a person is tested under gap filling rules, they may not be eligible for BadgerCare Plus. In most cases, we found this is because they actually did not report all their income when applying at the marketplace. Someone denied for gap filling can provide updated information to the marketplace or appeal their marketplace decision. Again, like Shannon said, though, if you're not sure, you have some questions or you suspect that they might be eligible for gap filling, you should definitely mention to the income maintenance agency that you'd like to have that, they'd like to look at gap filling for them. Former foster care youth. So this population is anyone who is in foster care, subsidized guardianship, or court-ordered kinship care when they turned 18. No income limit is applied to this population until age 26, so through 18 through age 25. And I should go back and clarify that this would be that they could have been in foster care, subsidized guardianship, or court-ordered kinship care when they turned 18 in any state. So it doesn't have to be that they were in, foster care, subsidized guardianship, or kinship care in Wisconsin. It could be that they were in it in a different state and now live in Wisconsin. And so now they're applying for BadgerCare Plus in Wisconsin and they're under the age of 26. And so they could still be eligible for BadgerCare Plus as a former foster care youth, and we would not apply an income limit to their eligibility. Earned income extensions. So when a parent or caretaker relative's income goes above 100% of the FPL due to increased earnings, their eligibility and their children's eligibility is extended by 12 months. This is kind of a transitional period for these folks. The extension continues as long as the household continues to meet basic non-financial rules. There's no income limit during this extension. However, if the household's verified income goes below 100% FPL during the extension, the household will go back to normal BadgerCare Plus. Again, you may know this as transitional medical assistance, TMA. I believe that's what it's called at the federal level, but it's earned income extensions. Continuous eligibility. So pregnant women who become eligible for BadgerCare Plus stay eligible through the end of the pregnancy. They are also eligible during a postpartum period that lasts until the end of the month in which the 60th day after the pregnancy occurs. Babies who are born to a mother enrolled in BadgerCare Plus or Medicaid stay eligible for BadgerCare Plus until they turn 13 months old. These eligibility periods for pregnant women and newborns continue even if the household's income goes over the program's income limit. And so continuous eligible babies or continuously eligible newborns, I believe this is one of the populations I mentioned in the earlier question about populations that are an exception from the Social Security number requirements. So this, just to clarify, this is that continuous eligibility newborn or continuous eligibility baby population I was talking about there. BadgerCare Plus prenatal plan or BadgerCare Plus prenatal program. So it's available to pregnant women who meet all other rules for BadgerCare Plus, but do not qualify because they do not have a qualifying immigration status or they are inmates of a public institution like jail or prison. Women are not eligible for BadgerCare Plus prenatal program if they are currently covered by any HIPAA health insurance policy. So they may not have current or past access to employer-sponsored health insurance plan in which the employer pays at least 80% of the premium. They do not qualify for backdated eligibility, and they do not get the continuous eligibility that I had mentioned earlier for pregnant women in the regular BadgerCare Plus program. Family planning only services, limited benefit plan for women and men of childbearing or reproductive age, covers certain services and supplies related to family planning. Income limit is 306% of the FPL. And for this one, the household size is always one, and only the individual's own income is counted. So we don't even get into like all those complicated household size rules or anything like that that I mentioned before with the regular BadgerCare Plus population. For this one, regardless of if you're married, who you're filing taxes with, not filing taxes with anybody, who's in your household size is always one. It's always you, the person who's applying, and only your own income is counted. Children's premiums. So again, these are normal rules. Right now we don't have the premiums going on because of the COVID, the temporary rules with the COVID-19 public health emergency, but just under regular rules, children's premiums. So children with household income above 201% of the FPL must pay premiums, except for pregnant minors, former foster care youth, children who have met a BadgerCare Plus deductible during the remainder of the deductible period, children in a BadgerCare Plus extension, all children under age 1, including those continuously eligible newborns, and American Indian or Alaska Native tribal members, the son or daughter of a tribal member, the grandson or granddaughter of a tribal member, or anyone otherwise eligible to receive Indian health services. Failure to pay premiums results in a 3-month restrictive re-enrollment period or RRP. However, the individual can re-enroll during the RRP if they pay those owed premiums. Again, like I mentioned, BadgerCare Plus premiums are suspended until after the federal public health emergency ends. So this information really just applies for when we're in the regular rules. Childless adults. So childless adults with income 50% to 100% of the FPL must pay premiums, except for American Indian and Alaska Native tribal members, the son or daughter of a tribal member, the grandson or granddaughter of a tribal member, or anyone otherwise eligible to receive Indian health services, individuals who are disabled, individuals who have resided in or are expected to be residing in an institution for at least 30 days, individuals who are homeless or have been homeless in the last 12 months, and individuals who are deceased. So those folks do not pay premiums. Again, BadgerCare Plus premiums and the treatment needs question requirement are suspended until after the federal public health emergency ends. And just to clarify, so childless adults can complete a health survey that may reduce their premium when they have the premium when we're under regular rules. And childless adults are also required to answer a question about treatment needs question that asks about substance use. Again, that applies under regular rules. All right, ready for poll question number 5.
Okay, poll question 5. Which of the following is not a scenario in which a gap filing determination will be done? An applicant or member requests a determination based on gap filling rules, gap filling, sorry. Response 2, an IM agency identifies that an applicant or member appears to be eligible under gap filling rules. Response 3, the Disability Determination Bureau determines that the applicant or member appears to be eligible. Response number 4, the marketplace sends an application to Wisconsin that has been identified as a possible gap filling case. Response number 5, the applicant has a letter from the marketplace stating that they may be eligible under gap filling rules. So again, which of the following is not a scenario in which a gap filling determination will be done? So which is not a scenario in which a gap filling determination will be done? Okay, most respondents picked answer 3. The Disability Determination Bureau determines that the applicant or member appears to be eligible for gap filling. In response to the question, which of the following is not a scenario in which a gap filling determination will be done? That is, most people selected the correct answer. Rachel, do you want to say anything else?
Yep, like Shannon said, most people selected that as the correct answer. The Disability Determination Bureau does not have anything to do with gap filling. They are the ones that determine if somebody is disabled or not for healthcare purposes. So they don't have anything to do with gap filling. So the majority of people got that right.
Okay, so we do have a couple questions. How much presentation do we have left, Rachel?
I think that's it. I just have additional resources, which is just pointing people towards the BadgerCare Plus Eligibility Handbook, which Shannon, I think you already posted that link.
Yep.
And then just saying direct, policy questions to that Forward Health Partners, DHS Forward Health Partners at wisconsin.gov address, which again, I think you've also posted as well.
Yeah, thank you so much. So are you okay to stay on for a few more minutes? Because I know we're well over time now. Okay.
Yep,
So participants, if you can stay with us and you can hear the questions, if you're waiting on an answer to the question and you have the availability to stay with us, please do. We will go through the questions now and then we'll wrap up for the day. So our first question is, for babies, after the 13-month period, do parents need to turn in income verification to stay on BadgerCare? So this is for those continuously eligible newborns that you talked about, Rachel. What happens after their first year?
Sure, and Marcel and Nikki, please feel free to chime in if I'm not saying this right, because I know you guys have a little bit more experience on the operational side than I do. But I believe what happens is essentially it's sort of a renewal situation where, at that point, I believe the Income Maintenance Agency will ask for information about, household income and things like that, and determine if the child remains eligible for BadgerCare Plus under the regular children rules. So, income under 306% of the FPL, if they continue to remain eligible for the non-financial rules. So I think it's sort of more or less like a renewal situation. Nikki or Maciel, is that correct?
Yes, they would have a renewal due.
Yes, it's just a relook at the case, see what they qualify. And also the good thing is that if they look to see at that case if they qualify for something else, that's caught during that renewal process as well.
Great, thank you.
Thanks, ladies. Okay, so we have a question. What happens if a child is adopted? So just, I think, in terms of applying for coverage when you've adopted a child.
Excuse me. So sure. So children who are adopted, excuse me, children who are adopted would be, thank you. They are considered for BadgerCare Plus eligibility in the same way as a child who is biologically the parent's child. So there really is no, I think, difference on how the family would apply for benefits, I guess. I'm wondering if that's maybe, I'm hoping that's getting at the answer to the question.
Yeah, it would go based on the parent's income. So the child is adopted, now a member of the family, they would definitely look at that family dynamic and their income to see whether or not they qualify for benefits.
Okay, we do have a clarification on that question, which is what happens when they are adopted and they were previously in foster care? Does that change anything?
It continues to go, the parents have accepted financial responsibility for that child. So they would go from the foster care system to being adopted and have the benefits from the parents. If they qualify for health care through their employer or whatnot, we would ask them to go through that. But if they are eligible for BadgerCare Plus, they can certainly apply.
Do those former foster care youth eligibility, special eligibility rules apply in that scenario?
No, the former foster care youth is really, those folks are already adults.
Okay,
So yeah, so in cases where like the child is adopted and they're still a child, they're like a minor, you know, they're under 19. Yeah, it would be like what Marcel was talking about. It's like they're part of the household with the parents, like any other child. The former foster care youth are like adults who are now applying on their own.
great, thank you. So now we have, can a pregnant woman that is under her parents' insurance plan leave her parents' insurance and apply for BadgerCare for herself and the baby?
Yes, I believe she can. Sorry, let me make sure I'm looking at the right information here.
Oftentimes, while you look for that, Rachel, oftentimes parents' health insurance does not cover the pregnancy themselves. So the mom would have to go ahead and apply for her own coverage to cover that, the prenatal visits and whatnot.
Yes, and I think it's really, when I was talking about like the limitations as far as if people have access to other health insurance, it was basically for the BadgerCare Plus prenatal program members. So those would be pregnant people who don't meet the qualifying immigration requirements for regular BadgerCare Plus as a pregnant woman, or they are incarcerated in jail or prison. So that's the population that has those other sort of restrictions with other types of health insurance they may have already.
Great, thanks all. Okay, so this is going back to the household, sort of imagining the household. So if a child under the age of 18 resides with a grandparent but is being claimed by a parent and is looking to apply for BadgerCare, how will the income or household be counted? So living with the grandparents on one of the parents' tax filings, how does the child's eligibility determination get made?
Right. So I don't know, Shannon, if you can, or maybe I can pull up the chart.
Back to the chart.
Yeah, that might be the easiest.
Let's see. Do you remember what chapter the chart is in? Sorry, I went away from it.
It's 2.3. I can stop sharing so you can share.
Okay, here we go. Here we are.
Yep. Okay, so in this case, let's say we're looking at the child's eligibility. Child is our target here. And so we're asking, so we choose a child. Is the target expecting to file taxes? Let's say no in this situation. So we go to step 3. Is anyone else claiming the target as a tax dependent? And we say yes, right? In this situation, it's the grandparents, right?
So they're living with grandparents, but let's say they're on mom's taxes.
Oh, okay. So yes, so they are being claimed. The child is being claimed as a tax dependent. So yeah, if yes, ask if the tax filer is the target's parent or spouse. Yes, they're the parent. If yes, ask if the child lives in one household with both parents who are not filing taxes jointly. No, they don't live in that type of scenario. If no, ask if the target will be claimed by a parent living outside of this household. So yes. So then we follow down and we go to relationship rules. And so if they're living in the home, if the child's living in the home, include the child's spouse, which let's say they don't have any or children under age 19. If they're under age 19, which let's say this child is under age 19, you would include his or her parents and siblings under age 19 if they're living in the same household. So in this household, right, the parents aren't living in the household. And in this scenario, were there siblings?
No siblings mentioned.
No siblings. So it would just be the child in the household.
Okay, great. So use that chart.
Yeah.
Okay, next up, and I can stop so you can take it back, Rachel. Let's see. So will the program requiring childless adults to pay premiums be ended by the federal government? Oh, here's a big policy question.
Yes, and that is a big policy question, because I do know that there have been, you know, with the change in administration at the federal level, and you know, the sort of this population, this childless adult population, Wisconsin, we are able to cover them through what's called a waiver, and so so I know that there is a lot of you know, things going on with that, and what we're allowed to do with that childless adult population. So unfortunately, I don't really have an answer at this time, but I will say that when you know that the Department of Health Services is in the process of planning for, you know, I guess the return to regular rules, sort of the rolling back of the temporary COVID rules, whenever that will happen. So there are plans in place, and so I will say that at that time, when we know that we're going to go back to the regular rules, there will be communication out, I think broad communication out about sort of what that means, and if there's any changes to the so-called regular rules from what the regular rules were before the COVID PHE. So, so yeah, I don't have any, that's a long way of saying I don't have any answers for you right now, but that information will be shared, you know, when we do have that return to the so-called regular rules.
Great, thank you. So we're down to some more complex ones at this point. One is, can we talk a little bit about the crowd out for children with access to parental employer coverage? So someone here is just making a point that children with employer coverage or with access to employer coverage may be subject to a crowd out if the employer pays 80% of the premium.
Right. And so those rules, so that's the crowd out policies specifically apply to those children, and so the CHIP category children. And so that's one of the examples of the rules where sort of the CHIP rules differ from the Medicaid rules. And so that's why, you know, in those scenarios, one of the things around CHIP is like the intention of CHIP is not to replace sort of these employer and sponsored insurance programs and things like that. So that's why we don't, you know, we have the so-called crowd out policies. As far as specific information on the actual crowd out policies, I know there's a lot more information about who is subject to it, who's exempt, and what we mean by these sort of current access, current coverage, you know, crowd out tests. So I know we're short on time, we're already over time, but I will say that Chapter 7 in the BadgerCare Plus Eligibility Handbook has information about the health insurance access and coverage and those crowd out rules. So I would recommend that if you're interested in getting some more information on how that exactly works, the policies around that, to check out Chapter 7 in the BadgerCare Plus Handbook.
Okay, thank you, Rachel. Yeah, and we are very much out of time here. So we'll do one more question, I guess. We're doing our best here. And that question is going to be about the temporary COVID rules, which the question is basically, how do they form those determinations about when the temporary rules apply? So if COVID lasts for another 5 years, do the temporary rules just continue?
Oh yeah, it really depends. So a lot of the temporary rules, and Marcel and Nikki chime in as well.
Yeah.
A lot of the temporary rules are coming from at the federal level. So if you are familiar with the CARES Act and some of the other like coronavirus related federal acts that have been put in place over the last year and a half, there's a lot of rules in there coming from the federal level that said that state Medicaid programs can do this or can't do this during this public health emergency period. And it does get kind of complicated. A lot of the rules are tied to that the federal declaration of a public health emergency and however long that lasts. But there are some complications in there as far as like when exactly the temporary rules would expire or sunset or whatever. So unfortunately, there's not really an easy answer to that. I don't know, Maciel or Nikki, if you guys have anything more to add.
No, I would agree. You know, we don't know when they're going to end. We don't know either, unfortunately, but when they do end, I mean, we will be absolutely communicating that information as soon as we know. As soon as we know what's going on, we will absolutely communicate that information to our members. So, Marciel, did you have something to add?
Yes, I do. I'm actually part of the COVID unwinding project, and we are getting direction directly from the federal government, letting us know what we can and cannot do. Currently, at this point in time, it is our understanding that the public health emergency may lift on December 31st, 2021. However, there is a possibility that it will be extended. So if you are not already on the DHS Forward Health Partner listserv, I would strongly encourage that you go ahead and sign up for that. And we will be sharing the most up-to-date information through our listserv, and also through, we may be connecting with Covering Wisconsin to do a webinar once those public health emergency unwinding begins. So all I can ask is stay tuned, and we will go ahead and be sure to go ahead and share that information as it's available.
Okay, great. Thanks, ladies. You've been so generous with your time. In closing, I just want to big thank you to Rachel. Thank you also to Nikki and to Marciel. Thank you to Mike for facilitating the technical aspects of this morning's webinars. Know that we will be back tomorrow with our second 2 sessions of pre-licensing training. You will get a link in your inbox tomorrow morning. That link will also be posted on Covering Wisconsin's conference webpage. So if you don't get that email or it gets buried, just go to coveringwisconsin.org and look for a link there. We look forward to seeing you all again. Just a reminder, if you are a new navigator or assister and you are required to complete this training because you're going through the pre-licensing process and you're going to take that exam, you must attend these learning sessions in order to get that credit. So please make sure that you arrive on time and are answering those interactive questions. And then just finally, a reminder to save the date for October 1st. If you have questions, we'll be having an hour of office hours in the morning, I think starting at 9 o'clock. And then at 10:30, we will also have a exam study session. Marciel has put some information in the chat about how you can get the Forward Health Program update, which is great, so helpful. I use it all the time, so I highly recommend getting on that list. You will use it too. And if you have questions, additional questions that we weren't able to address today, I also put that inbox in the chat. That's the DHS Forward Health Partners at dhs.wisconsin.gov. I know that's lengthy, but if you go to that link, you'll, I think, also see it there. So you can always send questions in advance or send your questions in that way. And thank you for your time and your patience and your attention this morning. We look forward to seeing you all tomorrow. Thanks so much.
Thank you.